Welcome back to Beyond the Stethoscope, where we explore the people and practices shaping the future of healthcare in the greater Philadelphia area. My name's Sam Bambino, and I'm your guest host for this episode. As flu season approaches, we're joined by frontline expert Jing Liang, a certified registered nurse practitioner from Trinity Health Mid-Atlantic, to talk about what you need to know to stay healthy this flu season. Hi, Jing. Thanks so much for joining us today. How are you?
Thanks for having me. How are you?
I'm doing well. To start, can you just introduce yourself and your role with Trinity?
Yeah, so my name is Jing Liang. I'm a primary care nurse practitioner at Cotman Primary Care in Trinity Health. Previous to this, I was a nurse at Jefferson in their heart unit for about 6 years.
To start, with flu season approaching, can you explain the difference between the flu and just the common cold?
Yeah, of course. So they're caused by different pathogens, but they're both respiratory viruses that can cause respiratory illness. The flu is normally caused by influenza A and B, and the common cold can be caused by many different things, but usually by rhinoviruses. The common cold tends to be very mild in severity compared to the flu, which can have varying different severities, but a lot of people can also have really serious complications from contracting the flu.
Can you talk about some of the symptoms and maybe how they differ between the two?
Yeah, so actually they do have a lot of overlapping symptoms, especially on the milder side. So common symptoms are like chest congestion, cough, fever, headaches, muscle aches, fatigue, that type of thing. But yeah, like the common cold does tend to resolve on its own without additional treatment, and the flu can also progress into pneumonia.
Oh, wow. Okay. Is there a way to know which one you have?
Yeah, there is testing available. Normally, if you go to urgent care or primary care or the emergency room, we do have testing for influenza A, B, COVID-19, and there's also testing for rhinoviruses as well.
And going off of that, you mentioned COVID-19. How important is flu awareness, given that, we're still only a couple years past the COVID pandemic?
Yeah, I mean, flu awareness should definitely still be one of our frontline priorities. The flu season doesn't go away. Flu season is between October and May of every year. But now we have this overlap between the COVID-19 and flu. So that definitely overburdens some of our healthcare systems. So it is important that we can do everything that we can to prevent the flu, to prevent that overbearing.
Can you speak a little bit about how the flu is spread and ways to prevent getting it?
Yeah, of course. So the flu is spread through droplet transmission. Viruses are spread through our droplets in infected individuals. So that can be from coughing or sneezing or even just talking to people can provide contact. You can also get it through indirect contact as well. So if you touch like a surface area that's infected with the virus and you touch your nose or your mouth and your eyes, then you can also get it that way too.
Mm-hmm. So hand washing and everything.
Oh, yes. Prevention, yes. Hand washing is very important for that. Wearing a mask when you're sick and you're coughing. If you're going to sneeze, cover it up with your elbow. And of course, getting the flu vaccine too will help with that.
Of course. Going off of that, can you explain the flu shot? I feel like there may be some misconceptions about it. How exactly does that work? When you get it, what kind of goes on in your body?
Yeah, of course. So there's a lot of information out there about the vaccines these days, but essentially the flu vaccine is a inactive or dead form of the virus or a very weakened form of the virus that's introduced to our bodies. And essentially it prompts our immune system to create these antibodies so that when we get in contact with the real deal, we have that protection already in place.
Sure. Are there typically side effects from the vaccine? Does everyone experience them if there are side effects?
Yeah, so normally people do experience some mild side effects, and usually it's just limited to the injection site, so a little bit of soreness, a little bit of redness at the site. Some people can develop little mild symptoms as well, such as like a headache or a little fever, but normally those are pretty mild and resolve on its own.
So just the common misconception, it's not that you're going to get the flu from the flu shot. That's wrong.
Yeah, that's a really common myth that if you get the flu shot, you get the flu, but that's just simply not true because the capacity is not there to be infected with the flu, with the vaccine and the dead parts of the virus.
Of course. Now, with the flu vaccine, are there certain groups who should definitely get it? Are there certain ones who maybe they shouldn't get it?
Yeah, of course. So there's very little exceptions to people who can't get the flu vaccine. It's pretty much recommended for all unless you have an allergy to a specific component in the vaccine or if you're a baby under 6 years old. But those who should definitely get it are our high-risk population, so people who have underlying conditions that predisposes them to having a complication to the flu. So those are our older individuals who are older 65, our babies, our young kids under 2 years old, pregnant women, those who live in like a nursing care type of facility, and those with chronic conditions like autoimmune diseases, asthma, COPD, heart failure, things like that.
When exactly is flu season and when should people get the flu shot?
So the flu season is every year between October to May the following year, but you can actually get the flu all year round. It's just a higher probability of getting it during the winter months because people tend to be more huddled together in crowded areas. But you should get the flu shot as soon as it's available at your primary care provider or the local pharmacy. So normally that's around September, October of the year. The sooner you get it, the better chance of protection you have.
Sure. Okay, what would you say to people who are like, I've never had the flu before, I don't need the flu shot, or they're just skeptical and hesitant to get it?
Yeah, so there's another myth that healthy people don't need the flu shot. And healthy people still can definitely benefit from the flu shot. Healthy people get sick all the time when they contract the flu. And it's also not just about protecting yourself, but protecting the community as well. Because when you get the flu shot, you prevent that spread to other vulnerable individuals like the elderly.
How would you say that flu season impacts hospitals, clinics, especially those at Trinity Health Mid-Atlantic?
So the CDC does estimate about 140,000 hospitalizations a year just from the flu alone. So the flu season is definitely very busy for the healthcare field, and it can take away time from people who get to the hospital with other severe conditions and they don't have the resources there. So it is really important on a primary care level that we really stress for those to get the flu vaccine to prevent that flu spread.
What can you share about, if someone wanted to come to a Trinity Health location to get the flu shot, what can you share about that?
Yeah, the flu shot is widely available anywhere. It's stocked all over the Trinity Health's primary care provider centers, so they can definitely come in and get their updated flu shot there.
Nice. And is that something that people can typically just walk in and get it, or appointments recommended?
Yeah, no, that's fine. If you just want to come in, if you're an established patient and you just want to come in for the flu shot, you get scheduled for like a nurse's visit, so you don't actually have to wait to see a provider. You can just be in and out for the flu shot.
Very nice. Jing, is there anything else about flu season, the flu shot, that you wanted people to know?
Yeah, it's flu is definitely a very serious health threat right now in public health, and it hasn't gone away, and it probably won't ever go away. So it is really important, even though we care about some of the other viruses that are coming out with COVID-19, that we don't forget about the flu too.
Of course. Well, Jing, thank you so much for joining us today. I appreciate it.
Thank you. Thank you for having me.
Remember, the flu isn't just a seasonal nuisance. It can get serious. Get vaccinated, stay informed, and help protect those around you. For more resources and to find a primary care provider near you, visit the link in the description below. Thanks for tuning in to Beyond the Stethoscope. Don't forget to subscribe and follow Trinity Health Mid-Atlantic on social media for new episodes every other Thursday.